Hello, Dr. Amit Kumar Dey. We're so happy to have you today on MedSynapse platform. I'm so lucky to have this podcast with you. Specifically, we are in a very new conference here in Egypt. It's the Pan-Arab Society for Intervention in Endocrinology and Diabetes Technology. Welcome with us on MedSynapse.
Thank you very much, Sarah. It's great to be here in Egypt, especially in this beautiful city of Alexandria. And we are at a fantastic meeting, the first annual conference of PASID, organized by my dear friend and colleague, Dr. Professor Hossam Ghazi from here in Egypt. Yeah.
Yes, thank you. So first of all, I want to know more about your medical background.
So I am a practicing physician and a diabetologist. I'm based out of the city of Kolkata in India.
Okay.
We also call it the city of joy.
Okay, wow.
And I have about a decade of practice behind me, predominantly a person who had been aggressively advocating the use of technology and artificial intelligence in the field of chronic metabolic and diabetes care.
Okay.
We do have a whole community now where we are having activities happening in the field of AI and diabetes care and technology.
This is great. So today you had a session in the conference. So I want to know more about your session, about the new updates in endocrinology.
Yeah. So I was given a very interesting topic by Dr. Ghazi to speak on the clinical utilities of artificial intelligence in the domain of diabetes management.
Okay.
And I was very happy to see a very engaging audience, AI and tech literate audience here in Egypt. And we had started with the discussion of the basics of artificial intelligence, giving them the nuances of narrow artificial intelligence and general artificial intelligence. And then we went into the discussion about what are the aspects where you can find the use cases of artificial intelligence in the field of diabetes practice.
Okay, this is great. And this is a new technique,
yes,
especially here in Egypt. So it's really, really great to listen to such a great session from such a great doctor like you to know more about the AI. So I would like to know what we can use, how we can use AI in endocrinology generally. What applications of AI can we use it here in Egypt or in endocrinology in Egypt?
Yeah, so artificial intelligence, as you see, Sarah, is not new. It's been there since the year 1950, since the time of John McCarthy and Alan Turing. And there has been a great deal of work in the field of healthcare on machine learning and deep learning algorithms, which has happened over more than 3 decades.
Okay.
And now, of course, we are seeing the evolution of a very powerful platform of generative AI that is actually transforming the practice and the way we look at artificial intelligence, and it's supposed to be very effective and useful, especially in the domain of healthcare.
Yes, you're right. You're completely right. Do you think that in the future we can replace doctors by AI completely?
No. Absolutely not.
Okay, because many doctors have concerns about this part.
Yes, certainly not. What we see is there's going to be a role play change.
Okay.
AI, as we call it, is actually augmented intelligence rather than calling it artificial intelligence. And it's going to augment the way we perform our clinical work.
Okay.
It can be a very useful assistant to improve your productivity,
okay,
whether you're doing clinical work or research work.
Yeah.
And you can have a great lot of predictions coming out of AI tools, which uses machine learning, screening of diabetic retinopathy using deep learning, or screening of diabetic foot ulcers much before they are formed. It can be a part of the primordial prevention.
It's like prediction of some common symptoms or some common complications of diabetes. So AI can be helpful in prediction of some maybe diseases or some symptoms that we can prevent before happening, right?
Yes. Okay. So prevention is always better than cure. And in chronic metabolic diseases, you actually have a bigger place of prevention because it not just reduces the disease burden, but it also improves the cost burden of that individual. Especially, I think, in a country like Egypt or even in India, a lot of healthcare is self-funded, if I understand. So it does become a burden to the individual if they are paying out of their pockets for their chronic diseases. So you can have artificial intelligence-driven tools that can actually predict the chances of you getting a diabetic retinopathy,
Hmm.
screen you very early in the
Okay.
disease before it is even developing, and also it can predict the chances of getting diabetic foot ulcers, and
Okay.
that can be done using thermal images and deep learning.
Yes, this is great. So, do you think AI will be a part of pediatric endocrinology as well? So, not also adult endocrinology, but pediatrics endocrinology can use it, because I'm a pediatrician, so I'm interested about this part.
I'm so happy you asked this question. So I did show in my presentation that we have a lot of use of AI in the insulin pumps.
Okay.
The modern insulin pumps that we are using
Yeah.
has got a great deal of AI algorithms inbuilt in them,
Okay.
which is actually improve the individual time in range and the outcome in the patient,
Okay.
especially if it comes to a pediatric population. What we are working on, Sarah, is also try to use generative and extractive AI, which can help the pediatric population, especially the ones with type 1 diabetes,
Yeah.
with carb counting,
Yes.
and that would be the next step towards personalized diabetes care.
This is very promising.
Very promising indeed.
We're so happy to have you, Dr. Amit, today on MedSynapse. It was a pleasure to have this interview with you, and we will have more and more discussions with you soon.
Thank you very
so
much for inviting me. And at the end, I would like to invite all our listeners to join us and be a part of the Doctors AI Global community, which is there on LinkedIn and WhatsApp. And you can find the link to the community at the end of this podcast recording. And it's always also there on the MedSynapse platform. And also a warm invitation to all my fellow doctors here in Egypt to join us at the Doctors AI Global Virtual Summit, which we will be conducting on the MedSynapse platform on 14th and 15th of December 2024.
You'll definitely join.